So hello, everyone. Thank you again for this opportunity. So today I'm going to introduce a new non-invasive diagnostic tool for functional assessment of coronary artery disease. Coronary artery disease, or CAD, is one of the leading causes of death in the world. The disease is caused by the buildup of fatty deposits in the coronary arteries. The treatment for CAD patients largely dependent on the degree of blood flow reductions in the heart muscle arising from the narrowing of the coronary arteries. So in other words, blood flow assessment is essential for treatment planning for these patients. Traditionally, the blood flow assessment is performed using invasive procedure. It is usually performed in a cath lab where the doctors will insert catheters and perhaps pressure wires to obtain some functional information in a stenosed coronary artery. But previous clinical studies have clearly shown that many patients referred for catheterization actually did not have flow-limiting stenosis. In other words, many of these patients are necessarily exposed to invasive procedure, which is also very expensive and time-consuming, as you can see in these numbers. So our solution is that we develop a non-invasive diagnostic tool that can provide a similar functional assessment for patients with coronary artery disease, but with a much faster and cost-effective manner. So the advantages of these solutions are to minimize unnecessary invasive diagnostic tests, minimize the cost of diagnostic tests, and minimize the time required for the diagnostic test, which in turn will maximize the patient throughput. I am showing one case to illustrate how this diagnostic tool can be applied in real-world setting. So on the left-hand side, this image shows the coronary artery obtained from the cath lab. And this image confirmed there is a 40% narrowing in one of the coronary arteries. The doctors also put in a pressure wire to measure a variable called FFR, which is the flow pressure gradient across the narrow segment of the vessel. And FFR is a very important vessel to determine a very important variable to determine whether the narrowing is flow limiting or not. If FFR is greater than 0.8, then the narrowing is non-flow limiting, and vice versa. So on the right-hand side, sorry, I need to go back to the automatic so that I can play this video. My apology for that. It didn't work. So on the right-hand side, it shows the diagnostic tool that we develop as an alternative solution. So this tool, as you can see, allows the doctors to analyze the cardiac CT images obtained from the same patient and to obtain some signal time enhancement curve above and below a narrow segment of a coronary artery. Then the doctors need to input several parameters, very easy to get, like the volume of contrast injected into the patient, and the pressure, systolic pressure, which can be obtained with a pressure cuff. And then the program will calculate the FFR for the doctors to determine whether the stenosis is flow limiting or not. You can see that the FFR obtained with this tool is very close to what the doctor obtained invasively in the cath lab. So we believe this diagnostic tool can be applied to a lot of cardiac patients. For example, in the United States alone, there are more than 20 million people affected by the CAD. And in each year, in US alone, approximately 10 million imaging tests are performed to evaluate the blood flow in the heart. And but many of these tests are done with an older technique with a higher radiation dose, poor spatial resolution, and largely qualitative assessment. So we believe our technology will have advantage of that. So assuming if we can penetrate 10% of those patient population, and if we charge, for example, $750 US per patient, this is the price range from comparable imaging tests, then we are talking about 750 million per year. So we believe the market potential is huge for this diagnostic tool. And our target patients are those with symptoms such as chest pain, but with stable conditions. And in addition to that, according to the current guideline, if these patients also have an intermediate degree of narrowing, like 40 to 90% lumen narrowing, then they are eligible to do a blood flow imaging test to determine whether the narrowing is flow limiting. So those are the type of patients that we target with this diagnostic tool. And the primary users or early users are hospitals, particularly radiologists and cardiologists will be interested to use this tool. So in terms of technology advantages, let me first briefly introduce how this technology works. So this technology is based on the following approach. We first inject a small volume of contrast, like 50 ml of contrast, and then use CT scan to take multiple images of the heart in quick succession. And then from the dynamic images, we can monitor the temporal movement of the contrast solution in each coronary artery, and then apply known physics principles to calculate the absolute flow velocity and pressure from which FFR can be derived. So this is a high-level explanation how our technology works. So in terms of the advantages, there is another CT technology in the market that can also derive FFR from CT images, but their method uses a totally different approach. Instead of taking multiple images, they take one single image of the heart, but with a slightly higher radiation dose. And then they apply supercomputer to simulate the blood flow characteristics in each coronary arteries. So as you can see, this approach will take a much longer time. I think right now it takes approximately 1 day for the company to return the FFR result. So image, in terms of the image analysis speed, there is a huge limitation. If the patient, needs a more urgent assessment, then it cannot be done. The second limitation is that the hospital will need to send the images to that company to run the supercomputer simulation. But I have talked to a lot of hospitals. They are not very comfortable about sending clinical data to a remote site. So I believe this is also a limitation. Another limitation is that the accuracy of computer simulation is substantially affected by if the patient have a dense calcified plaque or an implanted metal stent in the coronary artery. However, but on the contrary, our method is unaffected by this limitation because our method uses real dynamic data above and below a stenosis for the calculation, so no simulation is required. So this method can be applied to the patients with calcified plaque and metal stent, implanted metal stent as well. So we can offer a much faster on-site analysis and can be applied to a much larger number of cardiac patients. So in terms of the current status, as you can see, we have already developed a prototype software based on our patent pending algorithms. And this technology has already been validated in 2 single-center feasibility studies. You can see that the diagnostic accuracy in approximately 45 coronary arteries are very high, comparing to the current existing clinical methods. This graph at the bottom is from the first study showing our CT FFR measurements are highly correlated and agree with the gold standard pressure-wide FFR measurement in approximately 15 coronary arteries. So we are writing papers for publication on those studies, but in the meantime, I'm also leading a multi-center clinical trial funded by CIHR to further test this technology in a larger patient population, and the participating sites include some top cardiovascular centers in the world, including Germany, China, Japan, and of course, Canada. And also on the other hand, we are also developing a more professional user interface and also adding some visual tool for the software. For example, we want to present the FFR values in a color-coded 3D map like what you see in here. And I also want to point out that this technology has provincial IP protection, and we are now into the national phase of patent application in US, Canada, Europe, China, Korea, and Japan. So I believe this technology is protected in major markets. And finally, I want to briefly talk about the core members I have. I'm working with a group of 6-7 people, a very talented group, 3 programmers who focus on coding, graphics, user interface, and also the networking and security of the images in case if we want to allow the hospital to access to our software remotely. And we also have 2 image assistants who frequently analyze the images based on our prototype software and work with the programmers to further improve the software. I also have a research nurse to coordinate clinical trials. In terms of international partners, I already have 4 clinicians from different countries to agree to serve as a clinical advisor of this technology, or maybe to the company if we decided to start a company. And what I need now most is I want to connect with experts who can come up with a very good business strategic plan, and experts who have very much experience in the image software commercialization. So that's all I have, and these is my contact info, as well as the contact info of Kurt Brown, who is the Senior Business Manager responsible for this technology. Thank you again for this opportunity.